Welcome to Hints for Health, a series of podcasts covering areas and issues of concern and interest to global workers and those interested in having optimum health. Join us as we explore topics that affect most of us today and find ways to address potential challenges to your health. So let's join our hosts, Brian and Stephanie Kidman.
Welcome back to Hints for Health. I am Stephanie Kidman, a registered nurse, and with me I have my husband, Brian Kidman, a medical doctor. On our last podcast, we talked about how to prevent type 2 diabetes and how to detect if you have it already. This week we would like to give a few hints for health for those who already have been diagnosed with type 2 diabetes. Many people with type 2 diabetes can control their blood glucose by following a careful diet and exercise program, losing weight, and taking oral medications that help the cells make better use of the insulin that they do have. When oral medications and a person's natural insulin are no longer enough, then they need to take insulin in injection form, given under the skin. Many people with diabetes also have trouble with cholesterol and blood pressure and need to take medications to control those conditions.
There is a blood test that people with diabetes use called a hemoglobin A1C test that shows the amount of sugar that's attached to the hemoglobin protein in the red blood cell. That test should be done on a regular basis, annually, if a person's diabetes is well controlled overall, but as often as every 3 months if having trouble regulating the blood sugar levels with treatment. That test shows the average blood sugar during the last 3 months because that's how long a red blood cell lives before being replaced with a new red blood cell.
Dr. Kidman, what are some of the complications of diabetes if not well controlled?
Long-term complications of diabetes can include heart and blood vessel damage, which can then lead to strokes or heart attacks. Poor circulation in the legs can result in an amputation. People with uncontrolled diabetes can suffer kidney damage and failure, nerve damage as well, beginning in the feet that results in numbness and pain. Gum disease and sores can occur in the mouth, and complications with the eyes, especially with the retina, can lead to blindness if untreated.
Let's talk about what can be done to prevent long-term complications.
Yes. Educating oneself and being under a doctor's care are a great start. If you have diabetes, you should have an eye exam every year, and this will detect any problems that may begin occurring. Have your cholesterol and blood pressure checked regularly. To minimize problems with your heart and blood vessels, eat low salt, low fat foods, and keep your weight under control. By replacing salty snacks with fruits and vegetables and some protein, you can eat what helps and avoid what harms.
To avoid problems with your feet, be sure to wash and dry your feet well, especially between the toes. Check your feet for cuts, wounds, and sores. Wearing thick socks and comfortable shoes can prevent sores from occurring.
To avoid problems with your lungs, get a flu shot and a COVID shot every year and a pneumonia vaccine beginning at age 65. Smoking wreaks havoc on the lungs, so especially for those with diabetes, don't smoke. Fortunately, there are many good smoking cessation programs available.
Brushing and flossing your teeth every day is especially important for people with diabetes to help keep gum disease and infections at bay. Visit a dentist every 6 months for a skilled professional cleaning. Dry mouth or red or white patches in the mouth may indicate high glucose levels.
A good support system and a counselor can be helpful in dealing with the stress and sometimes depression that can occur with diabetes.
How important are eating habits? Can people eat what they want as long as they take their medication or insulin?
Keeping the blood sugar at a healthy level will prevent or slow down potential complications. And of course, what you eat affects your blood sugar. Each person needs to find the healthy blood sugar or blood glucose level for him or her. For most people, the target blood glucose range is 90 to 130 before a meal and somewhere under 180 about 2 hours after a meal.
Testing blood glucose levels before and after meals can help the person with diabetes make better food choices based on how their bodies are responding to specific foods. How often a person needs to check blood glucose level is determined by how well controlled it is. The blood glucose values should be recorded with date and time and any associated signs and symptoms that were experienced at the time the specimen was obtained. That information should be shared with a healthcare provider that the person is seeing. Let's talk about how to keep blood glucose in a healthy range.
Yes. Though it will vary somewhat from person to person, it'll be easier to adjust medication or insulin if they can eat about the same amount of food each day and at about the same time each day, and if they can exercise roughly at about the same time each day as well.
Eating balanced meals is super important for people with diabetes. Remember 3 times 3. Eat foods from 3 food groups 3 times a day.
By food groups, I'm guessing you're referring to eating a protein, a fat, and a carbohydrate.
Yes. I'll give you a quick review. Proteins are meats, poultry, fish, and nuts. Foods that have a high fat content include butter, oils, nuts, meat, and some fish and dairy products. Avocado, eggs, and coconut oil are also useful sources of healthy fat. Carbohydrates provide quick energy and are found in foods like bread, cereal, crackers, rice, pasta, and grains. Also, beans, fruits, vegetables, milk, and yogurts are considered carbohydrates. And then there are the sweets like sugar, honey, syrup, and molasses. They are a category of their own, but do add to the carbohydrate load. It is the combination of these groups that is important. For example, someone with diabetes should eat peanut butter on their bread or crackers because it has both fat and protein.
Yes. That way you avoid the spike and the later drop in blood sugar that occurs from eating a food that's principally a carbohydrate like bread or even a fruit.
I know everyone thinks fruit is healthy, but diabetics should eat fruit with a balanced meal and not as a snack by itself to avoid the spike and drop in blood sugar.
The fiber in the food is very helpful for keeping a balanced blood sugar. That's why whole fruits are better than just juice, and whole grains are better than refined grains and carbohydrates. Whole fruits and whole grains have the fiber needed to help keep the glucose level balanced.
Although beans and vegetables have carbohydrates, they are a much healthier form for diabetics than French fries, white rice, or white bread. Eating beans and rice together make it a complete combination of protein, meaning all 9 essential amino acids are present. Protein allows the body to build muscle and reduce the hunger hormone ghrelin, so you feel full longer. Furthermore, it helps boost metabolism.
Your body does not differentiate between a simple carbohydrate and a sugar. Either one requires insulin to process it and get it into the cell.
Is it okay for people with diabetes to eat desserts and sugar?
Yes. As a small part of their balanced meal, they can occasionally exchange some of the carbohydrates or starches in the meal for a sweet or a dessert. Smaller amounts obviously are better to keep the blood sugar levels from going too high. Remember, if the sugar elevates, it's going to drop later.
Could you give us an example of a healthy breakfast for someone with diabetes, Dr. Kidman?
Sure. So you pick your protein, you pick your carbs, and then you choose your fat. 3 food groups. But don't forget to make sure it includes fiber.
Let's play a little game. I will describe a breakfast. You and the listeners can either gong me if it's a poor choice or ring a bell if it's a good choice.
Okay.
Breakfast number 1. 3 eggs, 2 pieces of bacon, and 1 pork sausage,
Yum.
plus an 8-ounce glass of orange juice. Correct. Too heavy on the fats and protein, and too much juice. What if I only had 2 eggs and 2 pieces of bacon, with a piece of whole grain bread, and only 4 ounces of orange juice? Or better yet, a real orange.
I'd ring the bell on that.
Okay, listeners, how about a white bagel with cream cheese?
If the listeners gonged you, they would be correct. A white bagel would cause the blood sugar to spike. Insulin would be released too quickly and in larger amounts.
Okay. How about Greek yogurt with berries and coconut?
Ring that bell.
Oatmeal with nuts and raisins and coconut milk?
Let's hear the bell again. You've got the whole grain in the oatmeal with fat in the nuts and coconut milk. Nice balance. Protein, fats, and carbs to keep the blood sugar level and your energy sustained.
A donut or piece of white bread toast with butter and jelly and a cup of coffee with 3 teaspoons of sugar.
On that one.
Oh man, just got my favorite breakfast vetoed.
You'd be hungry and tired within an hour of eating that. I know that you're aware of the signs of low blood sugar, so can you go over those with us?
Yes, because I have experienced low blood sugar myself at times, even though I don't have diabetes. I begin to feel a bit jittery and hungry. I don't have energy and I can't focus. Some people feel weak, dizzy, and even have a change in heartbeat. I can easily remedy my issue by eating. But what should someone with diabetes do when they begin to feel symptoms of low blood sugar?
A diabetic with symptoms of low blood sugar would need to try to bring their blood sugar up rather quickly. If the blood sugar is 70 or less, then I would suggest eating or drinking one of the following right away. 4 ounces of fruit juice or pop, 8 ounces of milk, a couple teaspoons of honey or sugar, or some hard candy, maybe 3 or 4 or 5 pieces of it.
And what should a person do if their blood sugar is running too high?
When the blood sugar is running too high, especially when they don't know why, in other words, maybe they haven't indulged in something craze of eating too much cake, they haven't been a couch potato for several hours at a time, well, then they need to communicate with their healthcare provider and get their advice as to whether there's a need to adjust the diet, adjust the medications, or if the blood sugar is really high, maybe even going to the hospital emergency department.
Although getting a diagnosis of diabetes can be very discouraging, it is very possible to control it so that it does not control you. There are resources available for people who live both overseas and in the U.S. See our document section on diabetes to find the links, or you can find more education on diabetes.com or on the Center for Disease Control website when you search for diabetes. There are so many great programs out there to help and encourage you along the way. I know several people who are able to control their blood sugar by losing 20 pounds, watching what they ate, and becoming more active. It is so encouraging to see these people living a long and healthy life and staying active in ministry. You can too. May the Lord bless you and help you. His power is made strong in our weakness.
Thanks for listening to Hints for Health today. Join us again in the future for this series of podcasts that will help you in your goal of optimum health. This series is created and produced by Compassion Link, an Assemblies of God World Missions International ministry. I'm your host, Neil Ruda. For more information, visit www.compassionlink.org/hints for health and follow us on social media. God bless you.